The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors. We are gathered for the next episode of TMD Demystified, and I am Tony Urbanic. Today, the selected title and topic is TMD, TMJ, and the Internet. I had given this topic quite a bit of thought for a while. You might find it interesting or fascinating that having treated TMD for over 45 years, the first 30 of it surgically and the last 14 or 15 non-surgically, you would think that I spent some time looking at the internet as to what the internet said about TMD, TMJ. Well, I didn't, and I haven't, and I most recently did. Within the past week, I actually Googled TMD, TMJ, and I was not surprised by what I found, but I was surprised by the volume of absolutely misinformation, as they say, nonsense, confusion that is on the internet, which comes from quote, so-called reliable sources. Now, some of you may also say that, well, that's not surprising, or some of you may say, well, that's very surprising, but that's what we're going to do today for the next 30 minutes or so. I am going to go over extemporaneously with you what is on the internet regarding this problem, and discuss it as to the difference between what is on the internet and what I have discovered and what I have to teach regarding the simplicity of this problem. I know this may come across as somewhat authoritarian, and that's fine. And I have opened myself to criticism and challenge for years, and no one challenges me on this. I have not had one person challenge me on what I teach. In fact, I have had some rather sophisticated academics tell me, you're really onto something here. But we'll just leave it at that. But, after 14 years of developing the simplicity of treating TMD and the simplicity and the relative simplicity of the pathophysiology of TMD, no one challenged me on what I say, teach, or do, which frankly for me is quite surprising, because I challenge myself, first of all, to try to figure it out. And that was a challenge to myself. And I challenge, and what we're going to do here in a moment is we're going to pull up what's on the internet, or just portions of what's on the internet, and just go through some extemporaneously and discuss it to give you a grounding, some reality on what patients, and that's why I selected this topic, what patients are faced with when they look up TMD, TMJ. No wonder they're confused. No wonder they go off onto wild goose chases, and all kind of things. So let's just get into it. I think I posed the purpose of this episode, and I don't want to go on longer than we need to. I'm sure I'll make the point within the first few minutes, but I think there's so much to do. We could what I've already reviewed, I could probably spend several episodes just continuing on what is on the internet from so-called appropriate sites, not talking about patients' a point of view, but like sites that are supposed to know what they're talking about. So let me just screen share if I can. You can see on the Google that I just Googled TMD, TMJ disorder. And so we're going to go through some of these and we'll just go down the list and see what comes up and I'll discuss it. So first on the list here is something from the National Institute of Dental and Craniofacial Research. And I won't I won't say they don't have credibility. Actually, I was a fellow with the NIH, NIDCR for 2 years, and I had a fellowship at Vanderbilt through the NIDCR, and I was given a grant for 2 years to study facial growth and development. And most of you are not aware, but I actually proved that you could create facial anomalies, facial defects, using the laser combined with intrauterine fetal surgery. In other words, within the uterus, zapping a fetus with laser and creating a facial defect. And the animal model I used was rabbits, and that was way back in 1978, using that very first laser available in Tennessee. So I'm not criticizing the NIDCR as an institution, but I am criticizing what they have to say about this on the very first get-go. So they say temporomandibular joint disorders are a group of more than 30 conditions that cause pain and dysfunction. Well, first of all, it's not 30 conditions. You may have 30 symptoms. You may have more than 30 symptoms associated with this problem, but it's one condition. The condition is inflammation within the temporomandibular joint. The condition is inflammation within the temporomandibular joint. And if you can decrease the inflammation within the temporomandibular joint, all the symptoms go away. So, I mean, is this paragraph that is composed through the National Institute of Dental and Craniofacial Research a lie? No, I think they're just using the wrong word, and they have the wrong concept behind there, because it is not generated from 30 conditions. It is generated out of one condition, which is inflammation within the temporomandibular joint. And you can see I'm not trying to split hairs here or parse words. You know, words have definitions and definitions have meanings. And it is important that you use the right word to portray the correct meaning, or you're dead in the water. Let's see if I can move myself out of the way here a little bit. Let's go to this little diagram, this next. And this says the signs and symptoms of TMJ, TMD. So let's just, because I've reviewed this recently, and here's a little site that is prepared, giving basically all the symptoms that are portrayed by patients, and that's fine, really in their own words, rather than medical terminology, nomenclature. And I won't bore you by reading all these, but this goes through all the different symptoms that the patients can complain of. And I did read all these prior, and these are all fairly accurate descriptions of symptoms in the patient's own words. But what they portray is that it is a very confusing problem coming from all different directions. And again, the directions that all of these symptoms come from is inflammation within the temporomandibular joint. They even talk about your eyes here. Let's just go down to this one, because this is a very important one. Historically and scientifically, it has been portrayed that the main difference, in fact, the primary difference between TMD headaches, and we all know TMD causes headaches, and migraine headaches, of which the medical scientists can't give an explanation, do not know what causes migraine headaches, but the difference that has been given to differentiate between migraine headaches and TMD headaches is vision problems. Now, I am finding out and in experiencing with our patients that many patients with TMD headaches, they have hot joints, they have a long history of all the other symptoms, jaw pain, neck pain, tinnitus, whatever. They are also complaining of visual disturbances. And although I have not studied it in detail anatomically, I suspect that blurred vision or vision discrepancies are caused by the autonomic nervous system that is generated through the brainstem, which tells first the muscles of mastication, then the neck muscles, and then the shoulder muscles to tighten up. In other words, don't move. Don't move. And that is well established. Review any of the other recent or distant episodes that I've discussed, and you will see that the actual reason for all the disparate symptoms is that when the temporomandibular joint becomes inflamed, it sends a autonomic nervous system signal through the sympathetic portion telling the brainstem that the joint is inflamed, and the brainstem modulates the signal and sends out a concurrent signal through the autonomic nervous system to not move the jaw. That is how the joints of the body work, whether it be a hip, an elbow, or a knee. That is how all the joints work, and the temporomandibular joint is no different than any other joint in the body regarding the pathophysiology and how the joint actually operates, in the autonomic nervous system and the endocrine system. All joints operate the same way. So getting back to your eyes, I suspect, and I imagine there are ways to prove it, that when the autonomic nervous system sends a signal to tighten up, that part of that signal can be confused and send it to the ocular muscles, the cranial nerves, the 3 and 6, to cause the cranial nerves cause the ocular muscles to tighten up, which can skew the eyes, the globes, and create in various ways blurred vision or visual disturbances, which I see and now that I'm interested in it and I'm asked questions of my patients, I'm getting an increased number of people who complain of blurred vision or other visual disturbances that are definitely associated with TMD. But in any case, this goes through, other symptoms. Again, problems with different with swallowing, which would be easily explained by the neck muscles, the pharyngeal muscles getting a signal to tight, because when the signal comes down from the brainstem, quite often it doesn't differentiate between specific muscles. It just, as the problem persists over time or over severity, that is, problem meaning inflammation, persists in time or severity, the signals obviously would get more intense over time and severity and create more effect on disparate and distant muscles. So it is absolutely true that, the first symptoms that people usually get are associated with the muscle mastication, and then the neck, and then the shoulder. And it certainly is reasonable to think that the muscles of the pharyngeal area would get a signal to tighten up, causing these problems described here in your throat, having difficulty swallowing, your cough or clear your throat frequently, meaning it feels funny that you need to clear your throat, feels like there's something stuck in your throat. I've heard that so many times. I've heard that so many times. and you have a sore, it's the throat is sore without any evidence of infections. This is the one this is the first time I've seen this in any kind of position, but other signs and symptoms, including tingling and feeling of tingling or numbness in your fingers. Well, I also have had a patient yesterday who had that symptom, but whether it be just the fingers or the arm, hand, finger tingling and numbness is definitely associated with temporomandibular joint, which I've explained anatomically easily. When the strap muscles on the side of the neck get the signal to tighten up, they squeeze the brachial plexus, and when the brachial plexus gets squeezed, the nerves of the brachial plexus supply the arm, hand, and finger, and they feel like they are numb or tingling. Very, very obvious to all this stuff. And, I'm not going to go through all of these symptoms, but this is a good example of too much information without enough explanation. Too much information, but no concurrent explanation of why all those symptoms are coming from the same spot, from the same thing. And that is the differentiation between what I have to teach, what I have to say, what I have researched out, and everything else. So I think that, I made the point that, at least in this particular one. So let's go on and see what else we got here. What is the best treatment for TMD? Well, you read for yourself. Eating soft foods, using ice packs, avoiding extreme jaw movements like wide yawning and gum chewing. I mean, are you serious? I mean, that's the best thing they can come up with from the National Institute of Dental and Craniofacial Research? Short-term use, over-the-counter prescription medications also provide relief. Well, yes, they do. Of course they do, but only for a short time. But the point is, this is what the patients read. And this doesn't get them anywhere. I mean, it's like, that's what the authority says, just eat soft food. Well, if you're a bruxer, you can eat all the soft food you want, and it's not going to be effective. And ice is for acute trauma, acute inflammation. I mean, really acute within the first 24 hours. Afterwards, it's heat. On and off heat is the best treatment for chronic inflammation. On and off heat, not ice. That is a fact. So, why? I mean, I'm not sure who would put this together, except it's someone who doesn't understand inflammation. And avoiding extreme jaw movements. Well, how do you do that? If you go to the dentist and open widely and have your wisdom teeth taken out, or you have a second molar that needs a root canal, you're not going to avoid, and there is no way to avoid extreme jaw movements. And that's the best they can come up with. And I really like the way that the Google is set up, because they have different questions that come up that you can follow. Is TMJ a chronic illness? Well, yeah, it's a progressive chronic illnesses. It does vary between people, but it does affect everyone differently. But it is not temporary. It is cyclical. That's the first thing I have to say about it. It seems temporary, but it comes back. And I explain this to patients all the time. And I don't think I can remember ever anyone out of well over 6,000 consultations, over 4,000 successfully treated patients, but over 6,000 consultations, because not everybody gets the device and protocol. But out of that many people, I can't remember anyone who doesn't agree when I describe for them how the symptoms, whether they be symptoms of pain or any other symptoms are cyclical, and that is why it is cyclical, because it's connected to inflammation and the inflammatory cycle. So everyone agrees it's cyclical, but it is not a temporary thing. It is a progressive problem, and sooner or later it gets worse. Now, it is true everyone goes at a different rate, so you can have this problem in a minimal area, a minimal degree that can last for years and years, or you can have the cycles increase in intensity over a short period of time. But it is a progressive disease, and it certainly isn't a temporary disease. Let's see what other questions you might want to ask. Let's see how to stop TMJ inflammation, because we know the joint is damaged. You can see on X-ray, there's, in some cases, severe degeneration on a Panorex. This is fact, well known. How to stop inflammation. I've not seen this before, but let's go over this. How to stop inflammation. The following tips may help you reduce symptoms of TMD disorder. Avoid overuse of jaw muscles. Eat soft foods. Stretching and massage, which is exactly what you don't want to do. You want to rest the joint. If you have a tennis elbow and an inflamed lateral epicondyle of the elbow because of tennis elbow, repetitive movements, too many repetitive movements of the forearm, it's called tennis elbow. The proper treatment from the orthopedic surgeons is to put the arm in a sling, not do surgery, not give drugs, but put the arm in a sling to rest the lateral epicondyle. And the lateral epicondyle, when inflamed, sends autonomic signals to the brainstem that says tighten up, and tennis elbow is the primary complaint. It's not inflammation or pain here. It's pain of the forearm going all into the wrist where the muscles get the signal to tighten up. And when they tighten up, they pull on the periosteum of the bone where the nociceptors are there, and patients will complain of forearm pain, which is actually a deep pain of the muscles pulling on the periosteum. Temporomandibular joint disease and tennis elbow are the same disease, different joints. But stretching and massage of the joint, and this is from the Mayo Clinic, okay? This is my point. Dentist or physical therapist may show you how to exercise that stretch and strengthen your jaw muscles. You don't need your jaw muscles any more stretched, and you don't need them any stronger. What you need is to make the inflammation within the temporomandibular joint diminish. You don't need to do anything to the muscles. The problem, again, is the misunderstanding that somehow overuse of the muscles causes the problem. No, it doesn't. And you definitely don't need to massage the muscles, which brings me into the point of the effectiveness or the nonsense associated with Botox. You are paralyzing a muscle that has been given the signal to get tight, and that muscle gets tight, and it pulls on the origin and insertion of that particular muscle around the facial region, wherever that is, and is treated with Botox, which is certainly temporary and super expensive and repetitive, and over the long haul, not effective at all. And then number 3 here, heat and cold. Well, they don't even differentiate between the two. Ice or cold is for immediate damage, acute inflammation. Within the first 24 hours, it is effective to some extent by keeping the initial inflammatory response down, but to decrease a chronic inflammation, which is what this is, it's a chronic inflammation, not an acute inflammation, unless it's associated with acute episode of trauma, you will only use heat, and intermittent heat at that, because constant heat actually stimulates the inflammatory response. constant heat. I mean, talking sleeping on the heat overnight. That's constant heat. You want intermittent heat to decrease chronic inflammation. All right, so let's see if we can find something else to talk about here. Go back and see what else we can find here. Let's see what it says. Less is often best in treating TMD disorders. TMJ dysfunction affects everyone differently. True statement. For some, it is temporary and goes on for a week or two. We've already covered that. What is this going to bring up here? Less is often best in treating TMD disorders. It's from the NIH. Well, we learned certainly that surgery was not the answer, but less is not necessarily what you want to do if there's something better. Let's read this paragraph and see where it takes us. Until there is science-based evidence to help healthcare providers make sound treatment decisions, NIDCR suggests the following. Try simple self-care practices. Avoid treatments that cause permanent changes in the bite or the jaw. Avoid where possible surgical treatment of TMJ. There have been no long-term studies to test the safety and effectiveness. Well, I wouldn't disagree with that one for sure. That is why pretty much I quit doing surgical interventions 14 years ago. But again, self-care of just doing these particular simple things really don't get you anywhere if you do not actually treat the cause, which is inflammation within the joint. You don't want to treat anything that causes permanent changes to the bite or the jaw, but such treatments, they include, and this is kind of takes you into past treatments that have been, again, like surgery, found not effective, include Cronin Bridge work to balance the bite, orthodontics to change the bite, grinding the teeth down into a balanced occlusion, and repositioning splints, which permanently change the bite. Well, I would have to agree with all those because that has was done and still done in multiple sites, particularly by the TMD gurus that focus on occlusion as the primary cause. So there are only three causes. There's functional malocclusion, there is bruxism, and there's acute trauma. But the point is that doing things that permanently change the bite is not recommended, and I would have to agree with the NIH on that particular issue. So I'm not trying to say that none of the things on the internet are inappropriate, but this is what the patient sees, but this does not lead them to the truth, which is looking into how can you decrease inflammation within the temporomandibular joint? What is the best way to decrease inflammation within the temporomandibular joint? All right, so I think I've made the point. I don't need to go on and dissect every particular site within the internet. I think you can do that for yourself, but I would like you to do it. I encourage you to do it from the point of view of understanding really what causes this problem and compare it to what the internet has to say about it, because you will be confronted by your patients. You will be confronted by your patients who will ask you like this. They will say, what about Botox? What about dry needling? What about massage therapy? What about drugs? And they will name a drug or two that someone has recommended for them or they have been on for some time. The other problem I just want to touch on before we finish up, and that is how it rolls out that patients are referred for this problem. It is absolutely almost certain that if they go a patient with one or more of the symptoms previously discussed, go to their physician, if he suspects for whatever reason that those symptoms may represent TMD, will only have one thing to say: go see your dentist. Go see your dentist. The problem with that response is half the dentists don't want anything to do with TMD, literally 50%, and almost the rest, 49 and 44, 100%, make a night guard for the treatment of TMD. And then there's the 1/10 of 1% that are the TMD gurus that do all of the complicated, extreme diagnostic procedures and treatment procedures that are designed to do various things, but mainly designed so that they can be paid by medical insurance and gamed at the medical insurance level. That is the group of practitioners, providers, that I call TMD gurus. And they are very limited, but they are there. So, but that is the nature of this problem. And this is what patients are confronted with when they go on the internet, and their dentist says, I don't want anything to do with TMD, or their dentist makes a night guard, which is not effective in treating TMD. And then they go onto the internet and start reading some of what I just took you through. And it is totally confusing to the patient and gets no valid information that the patient can use. So I bring this to your attention. You may have already reviewed the internet much more than I have, but I thought that it was worthwhile to go through some of this, to be pragmatic about it, because common sense is the primary reason and the primary method I use to figure out how this all works and the real pathogenesis of temporomandibular joint disease. I hope it helps. If the listener, the viewer, would like to learn the specifics of treating TMD successfully by decreasing the inflammation within the temporomandibular joint, by unloading the temporomandibular joint like a set of crutches unloads a knee, or a sling unloads an elbow, decreasing inflammation within the joint adequately over a period of time, that the symptoms can be diminished by decreasing the inflammation easily, without drugs, without surgery, without any of the other non-effective treatments. You can contact me at tony@tmjservices.net. Our website is very explanatory, which is www.urbanictmj.com. Enough said for today. I look forward to the next episode, of which I already have a title and a plan on producing it. Until then, I'm Tony Urbanic, and this is TMD Demystified.